Welcome to today's presentation on neurology. We'll be covering 5 major areas: stroke, hemorrhage, seizures, movement disorders, and demyelinating disorders. Let's dive in. A stroke is a medical emergency that happens when the blood supply to part of the brain is disrupted. This can lead to brain cell damage. There are 2 main types: ischemic stroke, caused by a blockage in a blood vessel, often due to blood clots. Hemorrhagic stroke, caused by bleeding in the brain, typically due to the rupture of a blood vessel. Risk factors for stroke include hypertension, high blood pressure, atrial fibrillation, irregular heartbeat, high cholesterol, diabetes, smoking. These increase the likelihood of a stroke by contributing to blood clot formation or causing damage to blood vessels. A seizure is a sudden surge of electrical activity in the brain that disrupts normal brain function. There are 2 main types. Focal seizures originate in one part of the brain, causing localized symptoms like twitching or abnormal sensations. Generalized seizures involve both sides of the brain, often causing symptoms like loss of consciousness, shaking, and convulsions. Tonic-clonic seizures. Seizures can be triggered by various conditions, including epilepsy, chronic disorder of recurrent seizures, head injury or trauma, infections, for example, meningitis, brain tumors. Stroke can also cause seizures, electrolyte imbalances, or drug withdrawal. Treatment involves controlling the underlying cause and using medications to prevent further seizures. Movement disorders affect the way we move and can either cause too much movement or too little. Some key types include Parkinson's disease, a degenerative disorder where dopamine-producing cells die, leading to tremors, rigidity, and slow movement. Essential tremor, a type of tremor that primarily affects hands during movement, often improving with rest. Parkinson's disease is the most well-known movement disorder, but other disorders include Huntington's disease, a genetic disorder causing uncontrolled movements, chorea, mood changes, and cognitive decline. Dystonia, involuntary muscle contractions that cause twisting and repetitive movements. These conditions are often treated with medications like dopamine agonists, for example, levodopa, and anticholinergic drugs. Demyelinating disorders occur when the protective covering around nerve fibers, called myelin, is damaged. This disrupts the transmission of nerve signals. The most common demyelinating disorder is multiple sclerosis, MS, an autoimmune disease where the immune system attacks the myelin, leading to symptoms like numbness, weakness, blurred vision, and difficulty walking. Treatment for multiple sclerosis, MS, and other demyelinating disorders includes disease-modifying therapies, DMTs. Medications like interferon beta or glatiramer acetate help slow disease progression. Steroids to manage acute flare-ups and inflammation. The goal is to manage symptoms, reduce relapses, and improve quality of life for patients. To summarize, stroke, a medical emergency with ischemic and hemorrhagic types. Seizures, caused by abnormal brain activity, treated with medication. Movement disorders includes Parkinson's and Huntington's disease affecting motor control. Demyelinating disorders, conditions like MS where myelin is damaged, disrupting nerve function.